Hello everybody and welcome to the Tuesday edition of Video Clips, and as usual I'll start with some announcements. And the first one is that we have some institute classes that have yet to take place winter semester. Believe it or not, even though it's spring, we're still feeling kind of like winter here, and it is winter semester at the institute. So those are women's health, dietary supplements, and business training for health professionals. And then summer semester, we're starting to get all organized right now, and that will include the Diet and Lifestyle Intervention course, which is taught by the celebrity instructors Esselstyn McDougall, Dr. Ralph Moss, Neil Barnard, Alan Goldhammer, and the whole lineup. And that is the first step, by the way, in training to become a provider with Wellness Forum Health. So if you're interested in that, let me know. A second thing, the next issue of Informed will be out at the end of April. It will be on inflammatory bowel disease. I think you'll find it really interesting. Membership prices are going up in May, so you have limited time to purchase memberships at the $69 virtual rate before they go up. And we've introduced this new program, the Informed Medical Consumer Series, that involves 39 hours of education. Its full cost is $1,600, but you know how there's March Madness in the basketball field? Well, we're having April Madness here at the Wellness Forum, and you can do the whole program for $199. So lots going on, and if all of that just sort of ran by in a blur, why don't you call us at Wellness Forum Health, and we'll just chat with you about some of the options and things that you can do. All right, so I have a couple topics I want to cover, and the first one has to do with vitamin D, which seems to crop up all the time, but I don't see very many people coming here to Wellness Forum Health who aren't taking vitamin D supplements, so we have to keep talking about it. According to a recent meta-analysis, doctors should not recommend vitamin D for the prevention of chronic disease because evidence hasn't proven that supplementation is effective for this purpose, and side effects can't be ruled out. According to the researchers, vitamin D testing and supplementation has become a common practice with limited evidence that it benefits most people. Their words, not mine. And here's what they wrote. Because clear evidence of benefit over harm for vitamin D has not been proved, we should not recommend vitamin D supplements for prevention of chronic diseases such as cardiovascular disease, cancer, chronic obstructive lung disease, or diabetes until further definitive research is available. They also noted that vitamin D supplementation in combination with calcium could prevent fractures in elderly people, a conclusion reported by other studies too. And this is a very common thing. You know, everything benefits somebody. But the problem is when we try to take something that's beneficial for a tiny percentage of the population and make it available to everybody, that all the problems begin. All right, so the analysis was conducted by researchers from the Norwegian Institute of Public Health, which sets daily vitamin D recommendations for adults and children. Lead researchers said, a blood test is not needed to follow these recommendations. In the summer months, sufficient exposure to sunlight will help many to achieve these levels regardless of diet. So we're getting to that point in the year where even if you live in a northern climate like I do, you can get outside, and the human body was designed to produce vitamin D in response to sunlight. As for risks associated with taking large doses of vitamin D, the researchers noted that the risks of toxicity were low but real, and noted that the combined taking of calcium and vitamin D supplements increased the risk of kidney stones. And so these findings, combined with all the other studies I've been reporting on, really tell us that it's time to stop this madness. The testing methods are unreliable. We don't have any idea what ideal vitamin D levels are. We don't see much benefit in the medical literature in terms of taking the supplements. It is most likely, and I've covered this extensively, that the cause of vitamin D levels being low is disease, not the low levels causing disease. So it's time to stop this madness. The problem is, hundreds of millions of dollars are generated in supplement sales and doctor visits and lab tests every year, so it's not likely to go away anytime soon. All right, now, next topic, which I think is really interesting. I've been asking people trick questions with the percentage of people in various countries who eat a vegan diet. It actually is low in most countries. Israel has a pretty high percentage, 5% is considered high. Germans, 1%, 2% of people in the United Kingdom. I would have thought that Germans would have more than the UK, but that's okay. During the last 15 years, vegan eaters have increased from 1% of the population to 2% of the population in the United States, which means that we have a bit of a problem if we think that converting people to a vegan diet is the answer. At the current rate of increase, we will have 8% of the people in this country consuming a vegan diet by the year 2045. All right, this is not a really good thing. Another issue about all of this is that while some studies show that vegans have lower BMI and blood pressure and cholesterol and lower risk of disease, not all studies have shown a positive difference. And the reason is the varying eating patterns amongst vegans. Now, many of us have encountered what we call the unhealthy vegans who eat baked potato chips, fake cheese, fruit juice, sweetened cookies, and processed foods, and include a lot of high-fat food and oils in their diet. They're often overweight and they have persistent health issues. So the point is that just being vegan and eliminating animal foods is not necessarily the recipe for health. And from my perspective, some of these people would be better off eating a little bit of animal food and cutting back on all the processed junk food. And so consequently, we don't have consistent studies showing that being vegan is actually better for you. Now, a new study shed some light on the reasons people adopt a vegan diet, which go to explaining why the varying eating patterns. Researchers questioned U.S. vegans between the ages of 25 and 60, 245 of them. 45 out of the 245 stated that the main reason they adopted a vegan diet was for health. 241 said the main reason was for ethical concerns. The health-motivated vegans were more likely to eat a more health-promoting diet, more fruits, fewer sweets, that sort of thing. The ethical vegans were more likely to take vitamin supplements and to eat fortified foods and high polyphenol drinks and things of that nature. The ethical vegans, interestingly enough, were more likely to be vegan longer than the health-conscious vegans, but the point was they didn't eat a health-promoting diet, a lot of them. The authors wrote, quote, this is their quote, "This raises the question of whether the health advantages of a vegan diet result from just avoiding animal products or from an overall concern for health that includes choosing nutritious foods and engaging in other health-promoting behaviors." So there are 2 points I want to make here. One is that vegan does not equate to healthy. It can, but it doesn't necessarily always do that. And perhaps the community of plant eaters would be well advised to choose a different term, since vegan and plant eating means so many different things to so many people. So perhaps the term that should be used is health-promoting diet. The other is that this information can be useful in addressing the criticism that comes from opponents of eating a more plant-centered diet who point to these studies showing that the vegans and vegetarians aren't doing better. You can say that's because they're not all eating a diet that is my definition of a vegan or a more plant-based diet. So anyway, I think it's interesting to look at this, and what we have to do is get the ethical vegans to come over, and maybe maybe they would do it for the cause of improving the results that we see in studies. I don't know, but we got to get these ethical vegans to adopt a health-promoting diet. Vegan's a great start, but it's not where the journey ends. All right. That's all for today. As usual, pass this on to anybody who you think might enjoy watching it, and I'll be back to you on Thursday with more news.